So what I got for you today is my primary medic bag. This bag is made by Tasmanian Tiger. It is the Medic Assault Pack Mark II Small. There's a whole series of medic assault packs that Tasmanian Tiger makes. This is the small version. They also have a larger version, but I like the small because it's compact and they're all organized about the same. One of the key things I like about it is its size. It is very ergonomic and friendly to the user just based off of that. And then the second thing is that it's very organized on the inside. We'll get to that once I open it up. This bag does get me started on ALS interventions. I wouldn't call it my ALS bag. I have another bag for that right here. So this is my Meret Bag. It's got all of my more ALS interventions in it, like drugs for different things like cardiac arrest and whatnot. And it's also got some bandages for the boo-boos. And then if I need to upgrade the airway to an ET tube, I can do stuff like that using this bag. This bag I usually keep staged in the Bearcat. The Bearcat's always on scene 99% of the time. So all of our medics have their own Meret Bag and they stock it the way they choose. I'll get back to this in another video because there's a lot of stuff in this bag. So moving back to the Tasmanian Tiger, I've had this bag for about a year now. It stays with me on every op that I can think of. One of the highlights of it is the straps on here. You can wear it like a regular backpack. It comes with a bunch of extra straps. If you decide that you want to mount it to your kit, you can actually do that using MKii. I keep it in the backpack configuration just because it's easier for me to get on and off. Another thing you can do, you can take these buckles and cross them, and you can hide these other straps so that you have basically a sling-like backpack with only one strap. And then if you want to take it off your back, you just pop that one buckle off. On the front of the pack here, I have a soft litter pouch. This pouch didn't come with the bag. It was something I had laying around the house. It's just a general purpose pouch. I keep my soft litter in here. This is a North American Rescue Quick Litter Light. It's very easy to pack. It's made out of nylon with some webbing, and it's abrasion resistant. It's easy to reuse. Over here I have a pair of trauma shears, and then also a tourniquet and a Sharpie. This front zipper where I have my tourniquet, I just keep that tucked in there because it's easy to take in and out. And you can obviously increase or decrease retention with the zipper. Inside this zipper, I just keep some gloves. My department gets blue gloves, so I use blue gloves. These are nitriles. As long as they're not black, my personal opinion, I don't like using black gloves because it's a lot harder to see blood on black gloves, especially at nighttime when you're doing blood sweeps and you're looking for injuries. Blue or white gloves preferably will show the blood a little easier. The sides of this pack also have MKii cut into both sides, so if you decide to mount tourniquet holders or whatever, you can do that on the sides here, as well as the front, obviously, where I have my quick litter pouch mounted. Moving on to the inside of the pack, as you can see, it's very organized. Both sides of this pack come with these panels that are removable. And each panel here is preset with bungee. You can take the bungee out and reorganize it however you want to do it, but I like that because obviously it's customizable and you can set it up for the way that you like to use it. This pouch is removable, like I showed you with the panels. Inside this pouch, I have Narcan and a couple of IV start kits, along with some ammonia inhalants. A lot of the warrants that we do serve are drug-related, and with the fentanyl and heroin, it's always good to have Narcan on, especially if one of your guys get exposed. You want to get that taken care of right away before they go into some kind of respiratory arrest, and then leading into cardiac arrest. Contingency is key with things like this. So back here I have a couple of extra syringes and a couple of different options as far as administrating Narcan. If I decide that I want to go IV, I can. If I want to use the MAD device and go intranasally, I can. Or if I want to go intramuscular, I can also do that. This is just an IV start kit. It's basically just some simple IV supplies. That way if I need to administer medications intravenously, I can do that. Like I was saying, this bag is not my advanced pack, but it does get me started on some advanced interventions. For example, when you're dealing with trauma, especially related to facial injuries, some of the problems that you run into are airway issues. So in here I have different options as far as maintaining an airway. Obviously your primary go-to is going to be an MKii. So on the side here, there's some bands for you to keep your MKIs, or if you want to keep decompression needles on the sides, you can do that. If I decide that the patient has a facial injury and they're not going to be able to accept an MKii, or also have OPAs in the back over here, our next option is going to be to do a crike on the patient. So right here, I have a crike kit. This is a crike kit made by North American Rescue. If you're not familiar with what a cricothyrotomy is, like I was explaining, if you have an injury with facial trauma and you're not able to get an airway to maintain that patient's respirations, what you can do is use this little tube and you actually cut a hole in the cricothyroid membrane in the neck using this kit right here. So in this kit, there's a couple of different things. If you're not an ALS provider, I'm not going to go too in depth, but you've got a scalpel, a tray cook, a 10cc syringe for the bulb on the actual tube, and then you have a device to secure it. So back here what I have is called an eye gel. It's just another form of a supraglottic airway. And if you're not familiar with medical terms, a supraglottic airway is basically an airway that is designed to sit on top of the epiglottis. When we're using endotracheal tubes, we're putting the tubes into the epiglottis and inflating that tube to get control of the airway. This is a quick way of upgrading the airway from an OPA or an NPA before you move on to doing an endotracheal tube. Anytime you're doing anything relating to the airway or airway management, this is something that you want to have with you. I like this one because it comes compact. So once you undo this packaging, this BVM comes out like this, and then it pulls out. So you have a full-size BVM available. On the top side over here, I have some extra supplies as far as wound packing goes. Here I have a couple of hemostatic agents. On this side I have a couple of chest seals. Up top I have 2 ETDs, and then behind the ETD I have what's called a Mylar blanket. Mylar blankets are great for hypothermia management. Anytime you have someone bleeding out, one of the things you want to control is hypothermia. If the patient is too cold, the blood's not able to coagulate and they're going to continue to bleed. So if you get them warmed up with the assistance of one of these Mylar blankets, it'll help the clotting process and the patient's survivability will probably increase. And lastly up here, I have a 250cc bag of normal saline and a 10-drop set. Now when you're dealing with trauma patients, fluid replacement is extremely important. Now normal saline is probably third on my list as far as what's preferred to give the patient. Second being lactated ringers, and then number one obviously being whole blood. But having something to give the patient and get them started is better than nothing. So I keep that in here as well. So obviously whenever I'm reviewing some of the equipment that I carry, I try to make it clear that when I set these things up, these are set up for me in my area of operations. Some of these bags may be set up differently based on other people's operations or personal preferences as far as equipment goes. But this bag comes with me on every operation and I've never had an issue. So there you have it. This is my primary medic bag. If you guys have any questions, leave them in the comment sections and I'll get back to you.